Yesterday, I called for the public option to be non-negotiable, to be part of the health care plan. I went on and on about it for about 10, 15 minutes. I said, we must have it. And guess who apparently was listening? That's not a big deal. Barack Obama. Obviously. He was obviously probably in the chat room. You know how he rolls. And he came out today and gave a little speech in Wisconsin, doing some public rallies. This is where he really applies the pressure to the congressmen and senators on both sides of the aisle when he reaches out to the American people and speaks directly to them. And he said, we must have the public option as part of health care reform. Hey, look at that. That's excellent. All right, now we're having fun. I'm glad that President Obama's watching the Young Turks and agrees. Apparently not everybody does, though. You know what I'm going to go to first? I'm going to go to clip number 5 here. It's Chuck Grassley. He's a Republican from Iowa, and he's going to be talking to Andrea Mitchell about that public option. What he says, not really true, but you'll be able to tell from even what he says because it doesn't make any sense. But I'll come back and explain it just for fun. Here we go.
Right now, the Republicans on finance, all the Republicans except for Olympia Snowe, have come out against the public option. What is your objection to the public option?
My objection to the public option is based upon the Lewin think tank study that says 119 million people will opt out of private health insurance. When you only have 50 million left, premiums are going to go way up. And then the president's promise during the campaign that if you want to keep your existing health insurance, you ought to be able to keep it, will not be reality. And I think that when 80% of the people in this country are satisfied with the insurance we have, we want to make sure we don't upset that apple cart.
Wait. I'm doing the math here. Does this make any sense to you guys? He says 119 million people will opt out of private insurance. And then at the end, he says 80% of the people are satisfied with their private insurance right now. Well, if they're so satisfied with it, why would they opt out? Why does God need a spaceship? Think about it, Chuck Grassley. It doesn't make any kind of sense. He's like, no, we can't have this public option. It's going to be too good. Way too good. Everybody's going to get the hell out. And 119 million people are going to go. And he says, and then you see that the president cannot keep his promise of if you want to keep your private insurance, you can. But listen to that promise. If you want to keep your private insurance, you can. That is 100% true. But apparently, most people will not. See, but that's the whole essence of it right there. The Republicans know that 119 million people will take the public option. That's what they're afraid of. Now, why are they afraid of that? Obviously, the people are going to take that if it's a better deal, right? And so their constituents are going to get a better deal. So why do they care? Or why are they against it? I know, it's a joke, right? Republicans caring about their constituents. That's a good one. Come on. No, of course, their real constituents are the healthcare companies that are feeding them all this money, right, for their campaign coffers. So they know that the public option is better and that the public will choose it. He just quoted it on TV saying 119 million people are going to take it right away. There's only going to be 50 million left in private insurance. So if he cared about the people, then he would be happy about it. But he doesn't. He cares about the private insurance companies that pay his bills. And that's how, unfortunately, our system of government works these days. So don't let him trick you with any of this nonsense about how it's not going to work. And their main argument, as you can see here, is that it's going to work too well. I can live with that. I really can.